magical birth canal to be proud of. 20 years ago, when I was in an antenatal clinic with my wife, one of the mums asked the midwife, well, which do I have? Is it a birth canal or a vagina? Now, the mouth has one name. Whether it has food in it, and it's a chamber that retains food and feeds it to the teeth, a chewing chamber, or it modifies the sound produced by the vocal cords, so a voice modification chamber. No, it's a mouth. It has only one name. So the question is, does a woman have a magical birth canal to be proud of, or a vagina? Well, if we look up the translation, nope, it's not that one. Google Translate is here. The Latin vagina translates to the English sheath or scabbard. Well, that's an understatement. It is more than a sheath for a man's sword, a scabbard. It is a birth canal for baby, for without that magical opening, the human race would not exist. The biggest object that passes out of mummy's tummy is baby. So the only appropriate term to use in 2019 is birth canal. The Romans believed a woman was created specially for the pleasure of man, with a sheath for man's sword. Let's stop frustrating the autistic child who says, well, if a woman has a part of her body that's called a sheath, then why should I put on a sheath to stop conception or sexually transmitted disease being transmitted? It clearly does not function as a sheath. It functions as a birth canal. So a birth canal to be proud of. So the negative aspects around having a part of a body described as a sheath or a condom, we can do away with. And then the focus is on baby and widening this magical opening so there's no tearing and no cutting that actually aids the baby's birth. A technique described by Oxford and blessed by the Holy Church. So birth canal is positive, and it focuses our attention on widening that birth canal for baby. And we can tell men, you don't damage your wife. It recoils back like knicker elastic. All you're doing is stretching the fibrous coat of the muscles that make the pelvic floor. And then we appreciate the importance of no tearing, because tearing is not just tearing of skin as the baby exits mum's tummy through the birth canal. It's damage to a very important, powerful muscle of the lower abdomen that keeps all the contents of the lower abdomen, the urinary bladder, the uterus, the large bowel, actually inside the pelvis. Damage it and we have the consequences: prolapse of urinary bladder, prolapse of uterus, prolapse of the back wall of the birth canal from the large bowel, prolapsing through on the side where we've done the episiotomy or mum's had the tear. So it is a fundamental part of the human body, the pelvic floor. There is no reason to damage this pelvic floor muscle. We keep it working with its original strength for mum for as long as it can. So I leave you with a picture of United Nations flag. The United Nations plead to end avoidable deaths of mums and babies in childbirth by 2030. And what's drawn my attention to this? Well, Radio 4 talked about Armageddon, the antibiotic resistant bacteria causing Armageddon, and this is where this comes in. They referred to various newspapers, the Times. This is from the Daily Mail, as we can see here. Ben Spencer, medical correspondent for the Daily Mail, published 11th of September 2019. Fears of infection pandemic across different continents at the same time grow after 19 new superdrugs are discovered in the United Kingdom, including germs which attack the blood, the kidneys and bowel. So, speaking at the annual Public Health Conference in Warwick, infectious disease expert Susan Hopkins of Imperial College London warned the doomsday scenario is that we cannot treat patients. The antibiotics are no longer working. She asked that she added that in some southern European countries such as Italy and Greece, where antibiotic resistance is a bigger problem, doctors can no longer carry out bone marrow transplants in case a patient gets an untreatable infection, an infection that is resistant to all known antibiotics. Dr. Hopkins told doctors at the conference that they all need to take responsibility for reducing unnecessary use of antibiotics, which is driving the problem. There is no point in pointing the finger over there at other medical professionals, for example, the obstetricians. We are all personally responsible and professionally responsible, and we all need to take action together. So as a GP, the action that I can advise all mums to take is don't break skin. Skin is a barrier to infection. It will stop bacteria getting in, forming abscesses, blood poisoning called septicemia, for which we have to give antibiotics. And by not breaking skin, avoiding infections, bacteria will not have seen the antibiotic, therefore it cannot get resistant to the antibiotic. So the Oxford technique enables us to keep antibiotics working for our children and grandchildren. And I personally would add that it is every citizen's responsibility to inform other mothers. Oxford affords you a birth with no tearing, no cutting. Let's end the cutting, the female genital mutilation, the episiotomies and the tearing, because we can. We have a mum who delivered a 10-pound baby in Great Britain, snow baby Sienna. It was her third, so gradual birth canal widening to 10 centimetres will enable us to have antibiotics working for our children and grandchildren, and comply with Dr. Susan Hopkins' request to Imperial College London to take responsibility individually. So by all means, have a look at the other issues around the same time, both in the Times and other newspapers, about antibiotic resistance. The power is in the hands of women. If we can convince women that this part of the body, the birth canal, is beautiful, it's wondrous, it's symmetrical, and you can aid the birth of your baby, help baby out of your tummy before the start of the birth, then yes, The future is bright. We can beat the bugs, the bacteria, stop them getting more resistant to more and more antibiotics. So any mum I meet, potential mum, I always ask them, well, do you know of anybody who's pregnant? And they often say, look, can I see my tummy? And I direct them to my YouTube videos, Birth Explained for Children, to encourage more into midwifery, to think of midwifery as a career. Birth Explained for 16 plus, part 1, part 2, Birth Explained Sheehan's syndrome. So thank you for watching. Please tell 10 to tell 10 so that every mum avoids tearing, and then we will beat the bug, the MRSA bug. I'm relying on you. It's ironical, but the fate of men is in the hands of women. If they employ birth canal widening with either the Oxford method, opening doors for baby to 14 centimetres, or by the birth trainers, Epi-no, AniBall, then when we need antibiotics in our retirement because we've had hip replacements, should the wound get infected, there will be antibiotics that will work for us. Yes, we're trying to make the heavy metals by nanoparticle technology less toxic to our kidneys, but that is a problem of silver. It is toxic to your kidney. So it does kill the bacteria, but it also damages your kidney. So let's keep the antibiotics we have today working for tomorrow. Thank you.